Hi, I'm Dr. Kimberly Matthews, and this is my nurse Ruth, and we are going to talk today a little bit about PMS, or Premenstrual Syndrome, for all of you ladies out there that have that problem, as a lot of us do. So I think you had kind of come up with some questions that we get asked quite a bit, and maybe we can just kind of talk about those, and if anything else comes up.
So what is PMS? I mean, and how do you know if you have it?
If everybody else tells you you have. PMS is premenstrual syndrome, and it's basically a constellation of symptoms that women get before their period. So some of them may be physical, like abdominal bloating, breast tenderness, swelling, and some of them may be emotional, like, feeling like you want to bite somebody's head off when they look at you the wrong way, or feeling like you can cry very easily, just feeling very moody and irritable, and some people feel really anxious or tense, or not like their normal selves.
And when does that occur? I mean, how do we know if you know you have it or you don't know you have it?
Yeah.
When does it happen in your cycle?
When does it happen in your cycle? Well, the thing about PMS is that it's going to be something that's not occurring every day. If these symptoms are occurring every day, then it probably isn't just purely PMS. PMS symptoms, you usually do have an interval where you feel really good, and a lot of women, it typically starts up more in the second part of your cycle, and up till the point of your period, and occasionally it'll last a couple days into your period, but usually after the first few days of your period, women will, that really have PMS will just say, I just feel like a whole new person. All of a sudden I, kind of see the light. Like, I don't feel like I want to bite everybody's head off. I'm not cranky. I don't feel like crying. And that's really typical of PMS. And so, one really good way to know if you have PMS versus something else is to kind of chart it on a calendar, chart where your symptoms are occurring along with your menstrual cycle, and that will help us too to determine if this is really PMS, like we were kind of talking about earlier, or if it's something else going on, a mood disorder, anxiety, perimenopausal symptoms, because really with PMS those symptoms are going to get better after your menstrual cycle.
And most likely you're probably going to have to do it for several months in a row, just so we can get a clear picture as far as
that's right,
what's really going on, because there could be other things going on too. What can I do to, or what can a person do to help them get through those symptoms during that time?
That's a good question. There's a few things you can try to do just on your own. One would be, trying to find a good form of relaxation that helps some women. Also, exercise will help some women, so those are some good things you can do on your own. There are some studies that show that certain supplementations like calcium and magnesium may help, but those are things you might want to just talk about with your doctor before you start those. And then, of course, if it gets to the point where it's too difficult for you to control, then, at that point you'd really want to, after you're charting your symptoms and you feel like it's uncontrollable, then you want to come in and maybe talk to us, and there are some medical therapies that we might want to consider.
Yeah. So if it's interfering with your life, basically, and it's affecting everything in your life, you need to have a doctor look at it,
exactly,
and decide whether that's really what's going on, or if there's some other issues going on.
I mean, PMS is really common. Probably about 80% of women or so have some symptom of PMS, and for most of those women, it doesn't interfere with their life enough that they feel like they really need to do anything. But probably for about 20 or 30% of women, it does become a factor in their in their life, and enough that they feel it, or maybe, like I said, sometimes it is other people telling you that, which annoys us, but sometimes it clues us into the fact that maybe things aren't right for us, and makes us realize that we aren't feeling good as well. And then there's just a very small portion of people that have a really severe form of PMS called PMDD that is premenstrual dysphoric disorder, which it doesn't a lot of words for something that just is a really bad form of PMS that is really severely affects your life.
So once you have PMS, typically how long, if you're young, is it going to last forever, or when you hit menopause, is it going to stop?
Yeah, well, when you would hit menopause, it would stop just because your menstrual cycles would stop. So some people will still have, mood disorders, but actual PMS would stop because your menstrual cycles would stop. In PMS, I mean, a lot of times if you have it when you're young, you may continue to have it, but definitely different stages of our life, and different hormonal changes can alter how severe our PMS is.
Mm-hmm. And typically with PMS, doesn't it usually occur like right before your period, and once your period starts, then you're much better.
Right, exactly. You should pretty much be done with it.
When people can consider, maybe mid-cycle that they might start having symptoms, and then they start feeling better.
Exactly. And there are some medications that if you feel like just doing relaxation, exercise, and is not helping, then there are some medications we can use. Oral contraceptive pills for some women will help. Some studies don't support that oral contraceptives help, but for some women, because that stops ovulation, it will help them, although some women feel an exacerbation of mood symptoms with certain pills. There is one pill that is clinically indicated for the more severe form of PMS, which is PMDD, and so if you feel like you have that, that's something you should talk with us about. Some women will also get relief from using an antidepressant to help with their PMS symptoms, and not because you're depressed, but because the neurotransmitter that this antidepressant works on has also been shown to be abnormal in women with PMS. So, for certain women, that has really been clinically shown to help them with their PMS symptoms, and some people would take that every day of the month, and some women may just take it during the second part of their cycle. So that's something where, is why it's really important that you come to us, and if you have those symptoms, and don't feel bad about it because it's really common, and don't feel like you're a bad person or you shouldn't get help, because we can help you, and it is a lot more common than you think. So
well, you've answered a lot of the questions that I had about PMS, and I feel like I understand it a little bit better.
Good.